Hello everyone, this is Todd Kirkpatrick, your corporate safety trainer for McKinney's Incorporated, and welcome to another edition of Take 5 for Safety. And in this video, we're going to be discussing ergonomic awareness. But before we dive in, I just wanted to give a quick thanks to everyone for watching the videos and for supporting the process. We're hoping that you get some good information out of these videos and you're able to apply some of these pointers within your task on your working job sites. So please stay tuned in. We have more videos to come. So thanks again. So back on our subject of ergonomic awareness. OSHA describes ergonomics as a science of fitting workplace conditions and job demands to the capabilities of the working population. Simply put, ergonomics is body mechanics. It is the series of your muscles, your skeletal system, and tendons combined together to create body mechanics. So when we think about ergonomics and the injuries that come from ergonomics, they take a pretty big toll on the livelihood of that person and the employer herself when we deal with the aftermath of these type of injuries. The BLS reports that over 650,000 ergo injuries are happening every year, and over $20 billion worth of costs are applied back to the employers in this. Worker compensation claims per injury can come up between $29,000 and $32,000. And this is not too hard to reach if we think of just a typical shoulder injury without surgery can run in the range of $20,000. Indirect costs are reaching approximately $150 billion a year within private industry. And in 2010, musculoskeletal disorders accounted for 25% of all workplace injuries within construction. So this is a significant fact, and it's important that you address some of these issues. Some of the workplace problems that come in also are increased discomfort and pain, injury or illness for the workers, worker compensation costs for the employers, lost or restricted work time on the job site itself, short and long-term disability, increased absenteeism, greater turnover, lower morale, and decreased productivity and quality. So all areas of the organization are affected when we deal with ergonomic type injuries, just like most injuries. When we think about musculoskeletal disorders, or MSDs, these are typically an injury or a disorder of the muscles, nerves, tendon, joints, cartilage, or spinal disc. MSDs occur in an acute trauma situation or an accumulative trauma situation. Basically what this is meaning is this can happen within a certain time of doing something in an instant, or it can happen over a series of time. Accumulative repetitive motions over time typically add to these injuries. The most common occupational problems include back strain and tendon disorders. And at McKinney's, we know that we're having a series of back strains, so we need to take prevention measures. And we'll talk about that in just a second. Some of the signs and symptoms of musculoskeletal disorders are pain, discomfort, numbness or tingling, redness, fullness, tightness or swelling of the muscle group, limited range of motion, weakness, and trouble holding objects sometimes. If we think about carpal tunnel syndrome, this definitely comes into play. Early reporting of these signs or symptoms can give us early treatment and may resolve problems without lost work time, restricted activity, or surgery. Self-care can prevent issues from becoming more serious. And overall, the best method is prevention. So we want to think about prevention before we start applying body mechanics. So what are the risk factors that can cause MSD injuries or musculoskeletal injuries? Well, we typically refer to these as ergonomic stressors, and these come in the form of awkward postures, repetition, excessive force, static postures, meaning that you're in one place doing the same thing over and over, vibration, poorly designed tools, extreme temperatures can add to this, and poor work organization. And I know that we've talked a lot about organizations within our work areas, making sure that we have good housekeeping and the area is organized so we can work efficiently. So we want to think about controlling these stressors, and ways that we can control these stressors is one way is definitely reduce force. An example of this would be to minimize the weight that an employee must lift. So if there's an item that needs to be lifted, we definitely want to make sure that we're utilizing team lift. We want to reduce the friction when we're pushing or pulling material or items, and we do this with material handling equipment such as a hand truck and other items such as carts, dollies, and our jacks. Other ways to control stressors are to improve our posture by reducing the distance that we have to reach to an item or work, such as making sure that our ladder is in a good spot that we can reach to work. Make sure that we have good tools for this also to help with our posture and with the way we hold the tools. We can reduce repetition to help with these stressors. We can do this by considering job rotation or changes to a schedule so we're not doing the same task repetitively over and over and over again. We want to avoid long-term static postures also. The workstation design can add much benefit to preclude ergonomic type injuries. If we look at these examples here, the work is brought up to a waist level, which makes it a lot easier to get to and a lot easier to do the work. We definitely want to be on the floor doing this type of work. And I think most people realize that and try to get the work up close to them. But if you don't have something to get your work up, make sure you're ordering these items, a cart, a table, whatever you need, and get this out to your job site. Hand tools are another consideration you want to think about. If we look at the pictures here, the particular hand tool in this picture is having an unnatural contorted position of the wrist, which could lead to an ergonomic or an MSD disorder. If we look at the other picture here, is a correct way to handle the tool and hold the tool as the wrist is aligned in a natural position. So with this, we want to say no-go on the first and definitely a way to go on the second. So our tools are definitely important to get the right grip, the right ergonomic condition when we're handling our items. Proper lifting techniques is probably one of the most important aspects that we need to think about when we're on our job sites. We pick a lot of things up, so we want to make sure that we're picking things up properly. This is where we drop back into the awareness state where we should be all the time on our job sites and think about the lift. If we think about all the steps, there's a lot of steps. And we'll go through these steps. We do a lot of these automatically in our mind. But do this. Within the next few days, think about these steps when you're having to handle material on your job sites and have a conversation with your guys on your crews about this and discuss how many steps it takes to actually pick a box up. We do this in a quicker fashion through our mindset, but we know that it takes a lot of steps and we need to apply these steps correctly, such as make sure that you plan the lift. Look at the path of where you're going to be traveling with your item, that way you know you're not going to be tripping when you have it controlled. Check the weighted load. Obviously, we want to make sure that we can pick it up. We want to keep the load close to our body. Make sure you're thinking about the power zone here. Right in this area is our power zone and where we want to keep our items when we do get it picked up. Before we pick it up though, face the load. Do not twist. Bend using your knees and not your back. So we're making sure that we're getting a good control of this load, and when we have control of it, lift with your legs, not your back. Avoid quick, jerky motions. And don't twist your body to change direction. Use your feet instead. And this is very true when we're standing up. Once we have control of the load, we always want to transition into our turn after we've got control of the load and transition using our feet, not twisting our back. Keep the load in the power zone all the time until you get it set to its destination. And don't let the object obstruct your vision. Again, we don't want to create any kind of tripping hazards out there. So definitely think about these steps, okay? It's very important out there to keep our backs nice and healthy. Also with lifting, think about team lift. If it's too big to pick up, we definitely want to get help with this. And these pictures are a good example of team lift. And when we're doing team lift, make sure you're adding in a countdown, 3, 2, 1, 1, 2, 3, however you do it. Make sure you agree with the other person when you're picking the load up. And if you look at the pictures, they've got a nice alignment on how they're doing it. Their butt's down, their back is pretty straight, and they're communicating, and they're facing each other and having eye contact when they're picking up this load. And once they get it picked up, they can now travel and get it set to their location. The next item that we talk about here is our stretch and flex. I can't tell you another prevention method out there that is going to help us more than the stretch and flex program that we have. Definitely be involved in this and get other folks involved if you have to. Some folks are out there doing it more than once a day, but definitely do these in the morning and get yourself stretched out for this. The studies have shown that by stretching out, we have a lot less potential for injury through the day when we're using these exercises. So think about all these ergonomic points that we've talked about And when you think about these, think about where are your ergonomic hazards. Think about these hazards and how they could affect your task or your livelihood. The importance of proper body mechanics cannot be stressed enough. So please, always plan, prepare, and prevent. So from everyone at the safety team at McKinney's, this is Todd Kirkpatrick. Thanks for watching.